Welcome back, everybody. Dr. Peter Glidden here with you on the 26th day of August. Thank you for tuning in. Thank you for turning on. And now let's get our health back. Let's go right to Florida and talk to Carol. Hey, Carol, thanks for the phone call. You are live.
Hi, Dr. Glidden. Thanks for taking my phone call.
I'm happy to help. What's going on?
Well, I am so sleep deprived. I'm almost a zombie right now. I can't get to sleep. When I do get to sleep, I wake up every hour, and I wake up with such hot sweats.
Yeah.
And it's just getting worse. I've tried a lot of the things you mentioned to that fellow you were talking to before. I even actually switched the position of my bed.
Yeah.
I can't go outside and stand in the grass because there are fire ants this time of year.
Oh, ouch. What part of Florida, by the way?
Palm Coast.
Oh, yeah. It's pretty hot down there now, yeah?
Yeah, very hot, yeah.
Yeah. Okay. Well, all right. So how much do you weigh and how tall are you?
I'm 115. I'm about 5. I was 5'5". I'm about 5'4" now.
Okay. So now what about during the day? Do you get sleepy after you eat a meal and take a siesta, or find yourself falling asleep at inappropriate times during the day, or what's that like?
Oh, no. I have to be hit over the head to get to sleep. I do so many preps to get to bed, you know. I wind down. I wish I could.
So tell me what happens, you know, like, so what time do you eat dinner?
We eat dinner pretty late, about 8.
Okay, and do you go for a walk after dinner, or what do you do?
No, right to watching TV and to bed.
Okay, so dinner, and then you relax in front of the tube, and then it's off to bed. And so what time do you figure you're actually in bed under the covers?
Actually, we watch TV in bed.
Oh, yeah, okay. So what time do you turn the tube off and, you know, it's lights out, and let's attempt to sleep?
11 or 12.
Okay, and what time are you actually falling asleep?
Well, see, I start getting drowsy with the TV on. I turn it off, and as soon as I try to go to sleep, I can't. And then I'm tossing and turning. Sometimes I listen to you. You know, I've been doing that lately because I've been so interested in what you have to offer.
Yeah.
I wake up during the night and listen to you, you know, because it's so boring. I just can't get to sleep, and that it sometimes puts me to sleep and sometimes keeps me awake.
Well, I often put people to sleep. So how long has this been going on, Carol? How many months or years?
Years.
Was it subsequent to a particular event in your life? You know, like ever since you've been in Florida, or ever since you retired, or ever since your dog died? I mean, was there any precipitating event to all of this insomnia?
No, the last time I think it was in my 20s that I don't remember having a problem. My mother said I was a bad sleeper when I was a child, too.
That's interesting. Okay, but during the day, you're okay?
I'm tired. I'm always tired, but no, I can't sleep. I wish I could nap. Ugh.
Okay, so now, have you done, so which longevity supplements have you done, and tell me how, you know, what you've done in the supplement program.
I tried the Sweeties for a little while. I tried no sugar at all, completely eliminating sugar. The only thing I have is I make a tapioca pudding with stevia. And I use
No, that should be fine, you know, that should be fine. What about the liquid calcium? Have you done that?
I've done that. Yeah, I still do that. The Cal Toddy worked really well. Now I'm doing the teeth with the osteo and the liquid minerals. But
it's not. So the Cal Toddy was helping you to sleep?
Yes and no. Depended on the night.
Yeah, okay. So, very interesting. And have you stopped eating wheat, barley, rye, and oats?
Oh, yeah. I'm
okay,
on the
good
whole
girl.
Regimen.
All right. So here's what I want you to do as a little experiment here, and I just want you to do this for 7 days, because if this works, you're going to know in 7 days, okay? So, do you have any of the Cal Toddy left?
Uh-huh.
All right. So, and you said your body weight was, I'm sorry, I forgot, 150?
115.
115.
Uh-huh.
Okay. All right. So for 7 days in a row, here's what I want you to do. And do you have Sweeties in your pantry and Cal Toddy and OsteoFX? You have everything in the pantry?
Yep.
All right. So, again, after 6 p.m., I don't want you to have any Beyond Tangy Tangerine.
No,
I want the last dose to be way before that, all right, number one. And number two, do you drink coffee or tea during the day?
Never, no.
Okay, and don't have any caffeine, don't have like chocolate for dessert with every dinner or nothing like that, right?
No.
Okay, so we have to be completely caffeine-free here, or that can mess it up. By the way, in the listening audience, there's a difference between decaf and caffeine-free. You can't decaffeinate anything 100%. There's always about 3 or 4 or 5% caffeine in stuff that says decaffeinated. So if sleep is a problem and you're drinking anything that has caffeine in it, you need to just stop doing that completely and switch from decaf to caffeine-free. So regretfully, you have to stop drinking coffee, even decaf, until you get on the other side of the sleep problem. All right, so, but that does not apply to you, Carol. All right, so here's what we want to do. So, every night, 4 7 nights in a row, I want you, please, to do 2 ounces of the white liquid calcium immediately after you eat. For dessert, I want you to do 2 ounces of calcium, and then I want you to do 2 ounces of calcium again when you turn the TV off and you're, turning down the lights and trying to go to sleep. Now, I don't know how you're going to do that. You're going to have to keep You're going to have to keep 2 ounces of the white liquid calcium and a little bit of water or a little bit of juice or a little bit of Z-Radical right by the bed with a water chaser, so that when you click the TV off, you just reach over, throw down the calcium, and then wash it down with water, okay? And then turn the lights out and see if that doesn't happen. So I want you to do 2 ounces for dessert of the white liquid calcium. And then I want you to put an extra 2 ounces in a little tumbler right next to the bed with a little bit of a water chaser. Throw it down when the TV goes off and then chase it down with water. I want you to do that every night for 7 nights. So I want you to be taking 4 ounces of the liquid calcium in the evening. Okay, 4 ounces of the liquid calcium in the evening. Now, after dinner, I'd like you to do the Beyond OsteoFX. And on the bedside stand, I want you to do the Cal Toddy. On the bedside stand, I want you to do the Cal Toddy. And during the day, I want you to do 12 selenium. All right? I want you to do 4 selenium between breakfast and lunch. I want you to do 4 sweeties. I want you to do 4 sweeties between breakfast and lunch, 4 sweeties between lunch and dinner, and then 4 sweeties after dinner, between dinner and bedtime. I want you to throw 4 more sweeties down. Now, you need to do this every day for 7 days, because this is going to build on itself, hopefully, like a snowball rolling down a hill. And oftentimes, when you're having trouble with sleep, right, the problem is that your body's just gotten outside of the sleep groove, and to get that groove back, you're going to have to force the issue. And we force the issue by building momentum towards sleep. All right, now here's the secret sauce, okay? When you are lying in bed, attempting to go to sleep, the TV's turned off, and you've slugged down the Cal Toddy and the water chaser, and you're attempting to sleep, I want you, please, to lie in bed, and I want you to do 2 things. I want you to do a relaxation technique and then a breathing technique. And here's the relaxation technique. I want you to lie in bed on your back, put your arms wherever they're comfortable, and I want you to consciously take big, deep breaths, like on purpose, big, deep breaths, and then big, deep exhalations. So take as big a breath as you can, and then as big of an exhalation as you can. And you might want to, if you're not familiar with it, you might want to do a little Google search for the full yogic breath. It's called the full yogic breath. There's a thing that you can do with your abdominal muscles in order to facilitate really filling your lungs up by playing around with your body's diaphragm. So if you don't know what a full yogic breath is, then just check it out on YouTube, and then there must be 100,000 videos that teach you how to do it. So I want you to do a big breath in, big breath out. I want you to do that 5 times. 5 breaths in and 5 breaths out. And each time that you take the breath in, you want to imagine that the breath is starting at your toes. The inhalation is starting at your toes and washing up your body like like little waves at the seashore. Like you're lying at the ocean in one of those recliners with your feet pointing towards the ocean and the tide's coming in, and every time you take a breath, the water is coming up your body, but it's not water, it's your breath coming all the way up over your head, and then you're exhaling it all the way out and the tide goes out. The tide comes in with the inhalation all the way up your body, and the tide goes out with the exhalation all the way down your body. Do that 5 times. Big deep breaths, big deep exhalations, 5 times with imagination. Now, after you've done that, you want to just let your breath go back to normal. Take about a minute or so for your breathing to return to normal. You don't want to be forcing your breath anymore. Then when your breathing has returned to normal, I want you consciously to make your inhalation twice as long as the exhalation. So you want to just breathe in and mentally count how many beats it is. So you breathe in 1 beat, 2 beats, 3 beats, 4 beats, however many beats it is. And then you want to force the exhalation out so it leaves your body in half the time. So the inhalation is twice as long as the exhalation. It's a long inhalation and then a short exhalation. Long inhalation, short exhalation. Long inhalation and short exhalation. Now, you're going to be forcing this in the first 5 minutes because it's not a natural breath while you're awake. It's a very natural breath when you're asleep, but it's not a natural breath when you're awake. So you have to force the breath in and then let it out. Force it in and then push it out. Force it in and then push it out. When you do that for 3-4 minutes, you will just automatically get into that breathing groove, and then you'll fall right asleep. Okay? Check it out. Call me back. I'm on pins and needles waiting to see your experience. And if this does not work, I will eat my hat. This is Monday. Give me a call back at the end of the week. I'll look forward to it, Carol from Florida. I appreciate the trust. I appreciate your phone call. Now go out there and learn how to breathe. Ladies and gentlemen, I'm Dr. Peter Glidden, coming back. And we're back, ladies and gentlemen. Having a little bit of a trouble here with my Google Hangout today. Don't know what's up with that. But stick around. We love to do the live video stream. So stick around, and hopefully we will get those bugs aired out. But I'm still coming to you live with my audio signal. Today is the 26th day of August 2013, and it looks like Lisa from California wants to take a step up to bat and see what we can do. Hey, Lisa, thanks for the phone call. You are live.
Hi, Dr. Glidden. How are you?
Good, thanks. Hey, talk to me a little bit. What part of California are you in, you lucky bum?
Oh, I'm in SoCal. I'm in the Inland Empire.
Oh, you are. Specific. What town, if you don't mind my asking?
In Fontana. I'm not too far from the racetrack.
Gotta love it. Now, did you grow up there, or are you a California transplant?
Oh, no, I'm a transplant. I'm from Jersey.
Jersey, which exit?
Oh, I asked my mom this, too, because I wasn't driving when we left, and I can't remember it.
That's funny. Everybody, for those of you in the listening audience, if you're from New Jersey, love New Jersey, by the way. But, isn't that the truth? If you live in Jersey and you meet a new person, what's the first thing you ask them? Which exit? Because it's like one giant freaking turnpike there, man.
That's right, and it's kind of embarrassing not to know. I feel ashamed.
Well, that's the old Catholic guilt coming back at you. That's all nonsense. Don't worry about it at all. So, hey, Lisa, listen, thanks for calling. What's up?
I got 2 eye infections, and I'm not really sure where they came from. And, of course, the doctor can call in something. But I was wondering, can you use colloidal silver in the eye, or do you have to? Oh, yeah,
and you should. Yeah, man, I love colloidal silver in the eye. It is awesome stuff. If you get into the habit of using colloidal silver for any type of infectious thing, and, topically when it's indicated, so if you get a little bruise or a bump or a scrape or a scratch, you can use colloidal silver topically a lot and go overboard with it. You know what I like to do? I like to go to CVS or, Walgreens or wherever, Walmart, and get those little empty spray bottles, right? Little tiny things. You just take the top off of it and pour some of the colloidal silver in there, and then you can spray the colloidal silver topically. It's a much more economical way to use it. Just spray the heck out of any cut or scrape or scratch 5, 6, 7 times a day. Just spray the heck out of it and put a Band-Aid on it. Spray the heck out of it, put a Band-Aid on it. And it's going to go away in half the time. And the secret technique here to support and promote the structure and function of the eye in the face of an infection to the eye is you got to go get a little eye cup. It's called an eye cup. It's like $1.25. Any Walgreens in the world will have them. And it's a little oval-shaped glass tiny cup, and you put stuff in it and then put it on top of your eye and stick it right on your eye like a pair of swimming goggles, and you hold it there with one hand, and then you look up at the ceiling, so the liquid that's in the eye cup is now on your eyeball, and then you open and close your eye 5, 10, 15, 20 times and rinse the eye with the stuff that's in the eye cup. So guess what we put in the eye cup? The colloidal silver. So yeah, if you get an eye cup and put the colloidal silver in the eye cup and rinse the eye every 2 hours with the colloidal silver, whatever the heck this is going to be gone. And don't be surprised if when you do this the next morning you wake up and you've got this big, nasty clump of crap in the corner of your eye. Right, that's all the mucus and the dead stuff that your body killed, and now it's getting rid of. It happens invariably. For chronic eye infections like this, I would switch do you wear contact lenses?
Yeah, I was going to say, do I need to take my contacts out because I'm kind of blind as a bat?
Yeah, so you take the contacts out when you're doing the eye wash, absolutely. But I'm going to tell you, if this is a recurring thing, and it's a funny thing, and it's a new thing, then the first thing to think about is your contact lenses or your contact lens solution. So, I mean, have you switched it out? Are you wearing a new brand of contacts now, or have you switched optometrists, or are you using a different, cleansing solution at night? Has any of that changed up?
No, everything's been the same, except I just recently lost my grandmother, so I've been crying a lot.
Oh, well, that'll do it. Well, there you go. So that's it. And, if you're crying a lot with the contacts in, then that can be a problem. So sorry to hear about that. Now, listen, grief is a natural expression, and, the emotional body in a human being is like it's a stimulus response. So the more that you can cry, the faster it's going to resolve. The more that you can cry, the faster it's going to resolve. So look, don't feel bad. You'll be driving down the road, and all of a sudden you'll hear a song on the TV. You'll start bawling your eyes out. Just pull over to the side of the road and let the tears come out. The more you can cry it out, the faster you'll get on the other side of it. But the colloidal silver will be a great help to you in the meantime. Thanks, Lisa. I appreciate the trust and the call. Ladies and gentlemen, I am Dr. Peter Glidden. 866-582-9933. That's 866-582-9933. That's the number to call to speak with me live. 866-582-9933. Want to tell you a story now. One of the most remarkable cures, and I'm going to use the cure word here because I used homeopathy. This was early on in my career. Grew up in Massachusetts, and then after I graduated naturopathic medical school in Seattle, became licensed to practice naturopathic medicine in the great state of Washington. I moved back to Massachusetts to forward the cause of naturopathic medicine there, and for 12 years fought to get naturopathic medicine licensed in the great state of Massachusetts, but every single time we went to the State House, the American Medical Association and the knuckleheads from Harvard rolled out their dog and pony show saying that, oh, don't license those naturopaths. They have substandard training and they're dangerous, right? It didn't matter to the legislature in Massachusetts that Maine, New Hampshire, and Vermont and Connecticut all licensed and regulated naturopathic medicine. So I guess it was okay with those state legislators that, in those states we didn't have substandard training. I guess it didn't matter to the state legislature that the colleges of naturopathic medicine that we all graduate from were fully accredited by the Department of Education at the government. the same Department of Education that accredits Harvard University, the same Department of Education that credits Boston University and Tufts. Guess it didn't matter to them that naturopathic doctors graduated from licensed and fully accredited naturopathic medical schools in the United States, were eligible for government student loans, the whole 9 yards. Guess that didn't matter. We don't have a free medical market here, folks. We never have. And we're inching our way back slowly, but it's going to take 100 years before naturopathic medicine is licensed and regulated in all 50 states. In the meantime, you don't have to wait for that to happen. You can just join Youngevity, because with Youngevity, we're disseminating for free science-based, clinically verified, boilerplate health recovery programs developed by one of the greatest naturopathic minds ever to have lived, Dr. Joel Wallach. No kidding. You have access to all of this stuff right now. You don't have to wait until naturopathic medicine becomes regulated in your state and then pay for a consultation. You don't have to do that. This is why Youngevity exists, to bring Dr. Wallach's message and Dr. Glidden's message of health recovery through science-based medical nutrition to your living room. We've got it right here, right now. So step on up to the plate and let us help you. 866-582-9933. That's the number to call to speak to me live today. But so here I am. I'm practicing naturopathic medicine in Massachusetts. And, you know, it's an unregulated state, right? So it's not legal, it's not illegal. I'm certainly not going to deliver babies. I'm certainly not allowed to order any diagnostic tests. Certainly not allowed to do any type of intravenous therapy or even draw blood. But I have an office a block and a half away from Cape Cod Hospital, the biggest hospital in town. And my office is surrounded by other medical professionals, and I have a big sign right out there, right next to everybody else. Cape Cod Homeopathic Clinic, I think, was the name of it, right? I really continue, but even back then in my youth, I was as outspoken as I am now, because somebody has to be. Somebody has to climb on top of the mountain and shout from, the pulpit, shout from a bullhorn. So I was doing it then, but in a different way than I'm doing it now. We have a bigger microphone now. But so it's Friday. It's been a long week. It's Friday. I'm ready to go home. It's about 4 o'clock in the afternoon, and I'm ready to get out of there at 5 o'clock, right? I'm working the 9 to 5 before I met Dr. Wallach and saw the wisdom of network marketing. So it's 4 o'clock. I'm ready to go home. A mother and her daughter pull up in my driveway, and they walk into the office. They don't have an appointment. So they come on into the office, and, my secretary meets them, and they are, like, crying because the kid's in so much pain. The kid was crying. The mother was, a wet mess. And so I agreed to see them. What the heck? They're both in tears. What am I going to do? Say no, come back Monday? So they sit down at my desk, and they start to tell me their story. Now, this little girl, I think she was 9 years old. She had a definitive diagnosis of a neurological condition called reflex sympathetic dystrophy. And she had been treated at Children's Hospital for the last 3 years. But the MDs have nothing for reflex sympathetic dystrophy. They don't know what causes it. They certainly have no idea how to fix it. And so for the last 3 years, every time she would go to Children's Hospital in Boston, they would give her painful physical therapy, right? Physical therapy. Now, reflex sympathetic dystrophy is a condition that when you have it, your nerves are so tender and sensitive that if a butterfly were to land on the part of her body, she had it from the waist down. If a butterfly were to land on her knee, she would feel like she'd just been hit with a hammer in her knee. That's how sensitive the nerves are. Very, very, very sensitive. And physical therapy was like a freaking nightmare for this kid. But, they're the doctors. They're the mighty doctors. They know what's best for her. And so her parents are not going to say no to what the doctor says. So even though it's a painful therapeutic, they take the kid up there diligently for 3 years. Finally, she has one session, and they've had it. They're at the end of their rope. It's not working. It's painful. The kid's worse than she was when they go there. So they bring her to see me as a last resort. And I can't tell you how many times patients have darkened my door, or actually not darkened my door, but lit up my door as a last resort. right? Everybody goes to the chiropractor. Everybody goes to the naturopath as a last resort. It's nonsense, but that's the way that it is. That's the lot that we've drawn in this life, for better or for worse. So they're sitting down telling me the story. Now I'm practically in tears, right? Because I'm nothing if not a big empathetic human being. I've got lots of empathy for the sick and suffering. That's why I do what I do. So, normally what I would do back in the day, this is 18 years ago now I'm talking? This was a long time ago. Normally my standard office procedure back in the day was to do a round of blood work first and some objective laboratory analysis, and then a comprehensive hour-and-a-half consultation where I did an exhaustive health history and a homeopathic and a nutritional analysis. It was, a very sophisticated, stepwise procedure, and it's 4:30, right? And I'm done. I mean, I'm quick fried to a crackly crunch. It had been a long week. And, we didn't have the time to do all this nonsense. They're both in tears. They're telling me the story. I got to do something. So I say, all right, listen. Normally, when you come to see me, you have to do this exhaustive workup, but, you obviously don't have time to do this now. So I just asked a handful of questions, and I did what's called an acute homeopathic workup. Same thing that I would do if you came to me if you had an earache or strep throat or something acute, right? Very different than a comprehensive, full-blown analysis, which is what this kid needed because she had a full-blown chronic disease, and she'd had it for more than a year. She'd been suffering with this for a long time. So I do an acute homeopathic analysis on this child. Now, homeopathy is a separate and distinct system of medicine. Chiropractic is a separate and distinct system of medicine. Acupuncture is a separate and distinct system of medicine, right? Different medical disciplines have different diagnostic techniques, different medicines, and different therapeutics. Well, homeopathy is extremely unique in the wonderful world of medicine. And so my diagnostic analysis through homeopathy was very, very different than it would be if I was just doing nutrition. Homeopathy is a very, very unique system of medicine. So I ask a battery of questions. What does your pain feel like? What makes it feel better? What makes it feel worse? Where do you feel it? When do you feel it? When did it start? What's your sleep like? What types of foods do you absolutely love to eat? What types of foods do you absolutely hate to eat? What are your dreams like? Do you have any nightmares? Questions like this. Are you hotter than the kids in your class? And I don't mean hot like MTV hot. I mean, are you physically hotter or are you physically chillier? Do you have an extra sweater on in the middle of the summer? Are you running around in a short-sleeve shirt in the middle of winter because your body's so hot? What's your sleep like? What's your appetite like? What things in the world are you afraid of? Are you afraid of heights? Are you afraid of spiders? Are you afraid of snakes? All of these questions are part of the diagnostic array of determining a homeopathic medicine. Now, your medical doctor never asks you questions like this because your MD is not concerned with the real pathogenesis of your illness, and they have a juvenile understanding of how disease expresses itself in the human body. They have a juvenile understanding of how disease expresses itself in the human body. They are clueless about it. And all they do is throw drugs at it to manage your symptoms. Well, so I go through this battery of questions. Took about 15 minutes. And I'm scratching my chin. And in the back of my mind, I'm thinking, holy crap, this kid needs the comprehensive workup, right? There's no way I'm going to be able to figure this out. And now it's 5 minutes. So I have a flash of insight because a number of her questions lined up. And you ever done one of those Sudoku puzzles, right? And you get 3/4 of the way through it, and then boom, all the numbers just pop into your head, and you finish that sucker in record time, right? It's like, wow, that's awesome. Well, that was what it was like. I had a little eureka moment. Number of her answers lined up, and the skies opened up, and a light came down from heavens, and I knew exactly which medicine she needed. I knew it. And I gave it to her. Little homeopathic medicine cost me $10. I think I sold it to them for $15, right? Little homeopathic medicine. Little white sugar pellets that had been medicated with an extract of an herbal medicine called Arnica montana. Arnica montana. It's a little tiny wildflower that grows in mountainous regions in Europe. Arnica montana. I gave her 2 pellets under her tongue of Arnica montana. 2 little tiny pellets. They're about the size of a BB. Ever had a BB gun? You know what I'm talking about. About the size of a peppercorn if you're a chef. 2 pellets under the tongue, and I told her to take 2 pellets twice a day through the course of the week for the next 7 days, and then come back and see me, and we can do the comprehensive visit, right? So I send her home. And, you know, I'm thinking to myself, crap, I don't have a snowball's chance in hell of helping this kid with a little acute workup, right? But in the back of my mind, I'm thinking, yeah, but all of those things lined up, man. She needed Arnica montana. Monday morning, I get to my office. They are there before me. And I'm thinking to myself, crap, I screwed up, man. What did I do? You know, I'm thinking to myself, you always think the worst, right? So I get out of my car, and they're there again, with tears in their eyes, and the little girl comes running up to me, and she gives me a big hug, and she says, Dr. G, my pain is gone. After the second dose of the homeopathic medicine, the pain that she'd had for 3 years, that the MDs were making worse, was gone. And it stayed gone for the rest of her life. Reflex sympathetic dystrophy cured with 2 doses of a homeopathic medicine that cost me $10, cost the patient $15, plus whatever the charge was for the acute visit. I think back in those days it was $65. You got to be kidding me. So for $75 in an hour of their time, this kid's out of the woods. Ladies and gentlemen, your body has an unbelievable ability to fix itself. Your MD is clueless about how to do it. For goodness sake, belly on up to the bar, fire your MD, join Youngevity, get educated, and get your health back. Talking to Jay from Atlanta when we come back. Stick around. And we're back. Now, I forgot the best part of the story. Well, that was the best part of the story. I still get choked up every time I tell it. But remember, this kid had been going to see the MDs at Children's Hospital for 3 years, right? It was a regularly scheduled visit, and it was such a unique form of reflex sympathetic dystrophy that every time she went, she saw a whole team of doctors, like 10 guys, because it was a teaching college, right? They all flocked into the room where she was, and they took out their pens and papers, and so her mother is very excited because her mother doesn't understand the insidious nature of these people. So they go back for their next appointment, and the kid's cured. She's got no more pain. Now, look, she's been seeing these people for 3 years. It's a definitive diagnosis, and now it's gone. She's in a room with the main doctor and the 10 students, and they couldn't freaking believe what they were seeing. There's the kid right in front of their eyes. She is cured. Dumbfounded, the doctors asked the mother, what did you do? The mother said, we took her to see a naturopathic doctor, and he gave her a homeopathic medicine. It cost $15. When she said homeopathic medicine, all of the doctors got up and left the room. Nobody wanted to know. There was one guy from Israel. He wanted to know the name of the homeopathic medicine, but not a single one of them called me to say, Dr. Glidden, what'd you do? I know that you're trained in a different discipline. I know that, you do stuff that's outside of our wheelhouse. And look, we treated this kid for 3 years, nothing, and you cured it in 3 days. Not one phone call from the experts at Children's Hospital. That's why you need to fire your MD. For goodness sake, they're not worth even the mention of their names. Goodness sake, get rid of them, ladies and gentlemen. They ain't nothing but bad news. Jay from Atlanta's on the phone. Jay, I got 3.5 minutes to bring your health to resolution. How can I help? Thanks for the call.
Glidden, this is the first time I've actually called for myself, but I wanted to thank you and Youngevity and Dr. Wallach. Y'all saved my wife's life. I've called you a couple of times just in the last 3 months, and called you about a month ago and let you know that we went to the doctor after 80 days of being on Youngevity. My wife wanted blood work, and the doctor still, scared her and told her she might have cancer in the nodulars in her neck from the hyperthyroidism and all this. And so you reassured me, and then the blood work, we actually got it back, and it looked great except for one area you said was no big deal, but it's just a praise report. Part of this is just a praise report. So she is doing great, and so I'm on Longevity also. We're distributors, and I went to the doctor today because I have an elbow injury from 18 years ago when I was working as an automotive technician, and hit it so bad that it swelled up to the size of a small cantaloupe.
Ouch.
Well, after the swelling went down, I don't remember, maybe I was on naproxen at that time or whatever, but didn't stay on anything because being younger, probably around 30, my body, healed fairly rapidly and didn't think anything of it. And over the last 10 years, noticed things here and there. Well, I went today because over the last month or so, it is hurt every day. It has a little bit of swelling every day, shots of pain radiating up and down my left arm. And I said, I don't like to go to the allopathic reductionist, but maybe they can help me in this situation because this is an orthopedic surgeon. Maybe he can do something with my bone or whatever.
Well, all right. So look, we're running up against the clock, Chase. Okay. So I'm going to tell you what to do, and I want you to do this for 4 weeks, 28 days before you even consider surgery. Okay? How much do you weigh?
215.
All right, so here's what I want you to do. I want you to do 2 healthy bone and joint packs per month, 2 healthy bone and joint packs per month, and 2 bottles of plant minerals per month. 2 healthy bone and joint packs, 2 plant minerals, and 4 bottles of ultimate selenium. Now, I want you to apply the CM cream topically to the inflammation area of your elbow, and I want you to take the 2 healthy bone and joint packs and the selenium and the plant minerals every day appropriate for your body weight, like your freaking life depended upon it, and eliminate the 10 bad foods. Do that aggressively for 4 weeks. 4 weeks. Call me back on this radio in 2 weeks with an update, and I'll tweak the program for you if I need to. I don't think I'm going to need to. 2 healthy bone and joint packs, 4 bottles of selenium, and 2 bottles of plant minerals. Eliminate the 10 bad foods. See what happens. Avoid the orthopedic surgeon, because when all you have is a hammer, everything looks like a nail. Give me a call back in 2 weeks with an update. Appreciate your support. Appreciate the praise report. Ladies and gentlemen, that's how we do it. Teamwork. See you next time.